I am I'm going to share my screen right now and we will get started. So everyone can see this, right?
Yes, that looks great.
Okay, great. So anticipatory grief is somewhat in this day of an age of a foreign language, but it is a universal experience. So my main goals for this presentation is to normalize the experience of anticipatory grief, provide education to help you identify the feelings and impact that anticipatory grief can have on the mind, on the body, on the spirit, and on your relationships. It doesn't just happen to an individual, it happens to a family, to friendships. I'm also going to be highlighting the importance of communication in a changed reality that disrupts functioning. And then I'll also be discussing some practical tools to help restore balance and to help with moving through this time constructively in a way that makes sense for you. So David Kessler puts it, I think, the best. We're feeling that loss of safety. That's how he describes anticipatory grief. So just a little disclaimer, I will not be going into the theories and the, the stages of grief. Elizabeth Kubler-Ross, you may know her as the famous, 5 stages of grief. So she actually intended those to be for people who are on their deathbed, people who are, facing the end of their life. And then in recent years, psychologists and neurobiologists are realizing that grief is far more complex. There's no cookie cutter approach. It can disrupt functioning for sure. There are some common themes that are happening to the brain, to relationships, to the body. But the experience itself of anticipatory grief, there are so many levels and it's so different for every person, even everyone within a family, even every patient, every caregiver. And so that is kind of my disclaimer, is just to keep in mind that every experience is unique and personal and intimate. And there's no generalizations, and it's important to remember that. So considering the many levels that anticipatory grief has individually, within our family, within a community. So what is it? What is anticipatory grief? So it's one way that people react to hearing about a life-changing loss that's going to happen in the near future. Maybe not everyone experiences it per se, but it is a normal response to the sadness and the uncertainty that will come up when there's an impending loss. The other thing is, this is occurring in patients who are anticipating their own deaths, or family members or friends who are anticipating, the death of a loved one. The other piece of that too is sometimes, there's a diagnosis that is more chronic and there's no there's no timeline. And even if there is a physician who says, there's 3 months or there's 6 months, even within then, that's not a guarantee. You don't know. Sometimes they live for 6 years. Sometimes we just don't know. And so it's really that unknown, that uncertainty that really highlights anticipatory grief and why it's such a chronic emotional experience. Anticipatory grief can help, however, with settling any unfinished business, saying goodbye, preparing letters. If you're a patient, preparing letters to family members can sometimes be very comforting if it's hard to have that discussion. I'll talk more about that a little bit later. But I also want to highlight that anticipatory grief can still be experienced even if your loved one ultimately recovers. So we're grieving for what will be lost in the future. That's hopes, dreams, expectations for a shared future with the person who's dying. Family gatherings, birthdays, anniversaries aren't going to be the same. And just thinking about all of that can cause immense anxiety. So the several losses, just to further that, the roles in your family may change, even with, having someone get diagnosed with cancer, family roles change. You may fear losing your financial security. You may be losing your dreams. And it's not only within what I'm talking about here, it could be so many things, but my main point is just to highlight that there are many losses that come up. And grief doesn't occur in isolation. So thinking about a future loss can have you start thinking about past losses. So, it's not just an experience that happens in the present. The past is part of it. The future is part of it. So just to look at it a little bit more. So it's a normal response to anticipating loss and to loss of familiarity. It's a process of adjustment for the patient, for the entire family system. It occurs in patients, caregivers, loved ones, friends, anyone upon news that is life-threatening and or life-altering. It is very common to experience higher levels of anger and loneliness and loss of emotional control. There's anticipatory grief is a response to a change in abilities, either your individual abilities or caring for someone who has a change in their abilities. There is a loss of control, a loss of independence that can come up, a loss of just the family hierarchy system and how it normally functions. So this is kind of a long definition. It's from 4 family nurse practitioners who work in palliative care. And they write that anticipatory grief is an emotional response that is experienced before a true loss. You can also call it preparatory grief or premature grief. This specific subset of grief is an unconscious process that happens when stability is threatened by a new and unwelcomed diagnosis. So anticipatory grief encompasses the mourning, coping, and planning of one's life in response to an impending loss, as well as future losses. So losses of identity and function, potentially loss of life, accumulate along this illness trajectory. And anticipatory grief, it continues to be triggered. It's chronic. And so the result of this chronic, continuously triggering event is an overwhelming cumulative loss effect. It's described as a range of intensified emotional responses that may include separation anxiety, existential aloneness, denial, sadness, disappointment, anger, resentment, guilt, exhaustion, and desperation. Anticipatory grief can be a response to the loss of function, loss of identity, changes in roles, in addition to anticipating death. It's also experienced, as I mentioned earlier, by family, friends, and caregivers. So the symptoms can span physical, emotional, cognitive, and spiritual domains. And everyone will experience it differently. You can have your sleep impacted. You can get stomach upsets, physical symptoms. You may feel anxious or helpless or forgetful, angry. You may doubt your faith. So again, this is just not the whole scope, but at least attempts to provide some words to anticipatory grief. So the loss of identity and relationships, routine. The reason why I may sound repetitive in this presentation, but the goal is to start thinking about that for yourself. Start thinking about what has been lost for yourself, and what feels comfortable to communicate between family members about that loss. Anticipatory grief acknowledges that there are many losses and there are changes, there are new demands that patients and families go through. No one knows what to expect. There's a lot of uncertainty. This can, of course, heighten anxiety in individuals and within the family unit. And so again, you may lose sleep, you may have problems concentrating, it may be hard to make decisions, to remember things. All of this is normal. Because this kind of grief isn't usually discussed, sometimes people worry that it's not socially acceptable to express that deep pain that you're feeling. And so you may not get the support that you need as a result, but I'm here to normalize this. So just some more signs of anticipatory grief. You may recognize some of them. They may not, some others may not relate to you. Scattered thoughts, easily distracted, feeling fatigue. Self-care may be challenging. Feeling disconnected physically, emotionally, socially, fear of being misunderstood, feeling depressed, guilty, lonely, your perception of time may be off, thinking about the upcoming loss frequently, feeling anxious or irritable, emotional numbness, impacting your self-esteem, your sense of self, questioning, the who am I, what's my role, why am I here, all the existential questions. And then for patients who are dealing with a diagnosis that's life-threatening, there is, that whole world of anticipating death and facing many losses from past, present, future. There may be a wide range of thoughts and feelings happening all at once that can just feel overwhelming in response to the struggle of coming to terms with this diagnosis. These reactions can feel very intense. They can feel frightening. They can feel overwhelming to anybody. And it can help to know what to expect and that these reactions are a necessary and normal part of grief. the more you have understanding of what specifically the response is doing in your mind, in your body, then, the better able you will be to start coping with it.
McCall, a couple of questions came in. I'm wondering, can you take just a couple?
Yeah, of course.
Well, somebody first off just commented that they were experiencing kind of all the above when you went over different ways that it manifests. And I bet a lot of people relate to that. So thank you for sharing to the person that said that.
Yeah.
A couple questions came in. One says, how do you hide all these emotions from your partner as she is struggling with her own loss? I wonder if you should hide those feelings, but I go to you, McCall. How do you hide all these emotions from your partner as she is struggling with her own loss?
Yeah, that's a really great question. And it's not easy to talk about. It's really, really hard for both patient and caregiver and family member to talk about it. Everyone is different. If, writing a letter may feel comfortable, that can be a go-to. If you feel like maybe going to a therapist to have someone kind of there facilitating a conversation to help talk about these difficult emotions will be helpful, then again, that's for the two of you to decide. But there are again, there's no like right or wrong. The point is, what do you want to do with the time? How can you make the most of the quality time, and how do you help each other with regulation, or how do you help yourself with regulating those emotions? That can also be an area of focus. But the point is to have some kind of outlet for these emotions.
Thank you, McCall. This is kind of a clinical question. It sounds like there's a therapist on this call. They said, today, two of my patients complained that I was not present for them. Maybe I shouldn't be practicing right now while my husband is dying.
That's a fair question. Definitely not a decision that I can make. But that's a very real question. And at least what I learned is to consult with other clinicians and see what they think. But that makes a lot of sense that it would be harder to be present.
Thank you, McCall. That was it for now. Thank you.
Yeah, thank you for the questions. So some common questions that you may recognize. Why don't I feel like myself? Why can't I sleep? Why am I having stomach problems? Why do those pictures keep popping in my mind? Why is my heart racing? Why do I feel numb and depressed? Why do I feel so disconnected from everyone? And the feelings and reactions that you're experiencing, it's your mind and body trying to adjust to something that's very stressful and something that's also chronically stressful. I mean, we also have to consider that, when we love someone, when we care about someone, there's an attachment there. That attachment is being threatened, and any threat to the body, to the mind, any threat to that bond is absolutely going to cause your entire nervous system to go haywire. I'm going to talk about the neuroscience, a little bit of that, but just to understand your reactions is that's the first step, that self-awareness. Where are you? What's going on? And then you'll be able to start coping to help you restore functioning, or at the very least to help you feel more regulated. So again, a chronic or a terminal illness, it poses a threat to survival and functioning of an individual's physical world, emotional world, cognitive world, spiritual world. You're going along in one reality and it just shifts seemingly overnight. And anticipatory grief is our individual response to that external disruption. This internal response, it destabilizes our body's system, our mental system, our emotional system, our family system. So it makes sense that it's a very overwhelming process that makes it very hard to stay present. So the emotional pain and sadness that arises is another way to think of anticipatory grief, as you are expecting or being told that there will be a future loss or death. So homeostasis, that's the body's attempt to stabilize everything. I think my pen is on. That's the body's, that's how the body stabilizes everything. So the body can't stabilize if its survival is threatened. There are bigger fish to fry. So the first focus is surviving and getting through it. So, you know, you're not going to sit there and think about, okay, what do I do about this? What do I do about that? Like, you're going to be focusing on running away or fighting, or, you know, tasks, things that are easier to make sense of. So we are wired to respond to these threats automatically, the fight, flight, or freeze response. So just some, sorry, I didn't know how to get, oh, there we go. Just a little bit of psychoeducation. So when a traumatic or stressful event happens, that's the red lightning bolt. That is, you know, a cancer diagnosis. You just heard that someone you love got a terminal diagnosis. Absolutely, it's going to be very hard to just stay calm. You will be bumped out of the resilient zone. Some people go into the high zone. They will feel irritable and edgy, have a short fuse, panic, have anxiety, get angry, want to, you know, fight the doctors or the nurses, each other. Other people may be bumped into the low zone. They may be numb. They may feel sad or depressed. They may want to just isolate. They may feel exhausted and disconnected, don't want to talk about it, don't want to hear about it. You know, everyone, again, is different. But the point is that absolutely, if we are a human being, we will get knocked out of the resilient zone. So just briefly, the nervous system, it regulates activities in the body and mind. The brain is part of that nervous system. So just to make it simple, you know, we can break the brain down into three parts. There's the thinking brain, the emotional brain, and then the automatic brain, the survival brain. So when we hear cancer, terminal, our survival brain is just automatically activated because our emotional brain perceives danger. And of course, it's a danger, it's a threat to our life. So when the survival brain, the automatic brain goes off, we're not thinking. It just goes into action to save your life. Your heart rate goes up, your breathing gets faster, and you are thinking about, you know, just there's a flood of information. Usually it's a shock at first. So there's also the freeze response, which you may identify. You know, common language like scared stiff is another way to describe the freeze response. And again, this is an automatic response. It's beyond our control. It's our body responding to an external disruption that is a threat, that feels threatening. So there's a hijacking of the nervous system that can happen. And this can happen, you know, years later after hearing the news, after dealing with a medical diagnosis. Something in your environment can trigger that, and you will be automatically in your survival brain again. So I'm just providing all of this just so you know that, this is kind of what's happening underneath. And once we can remind ourselves, okay, that's just my survival brain, then we're able to go to the tool, talking to someone, regulating, going on a walk, whatever helps us. So normalizing the body's response, that's what I'm doing by explaining this. So grieving for someone who is still alive, it may not necessarily be a trauma. I know that there are some clinicians that don't agree that it's called a trauma. Everyone is different, but just for the sake of this presentation, I'm going to call it a response to trauma. It's a response to stress, a chronic stressor. So much about anticipatory grief is simply our body's stress response, trauma response, and its natural inclination to enter fight, flight, or freeze mode when someone we love is still alive, but in what we perceive as a very dangerous situation. Our body gets flooded with stress hormones, and now that's going to elicit a chemical response in anticipation of having to quickly react to some kind of perceived threat. When we continue to expect and seek out these negative symptoms of anticipatory grief without engaging in coping mechanisms that can help us, go back to our resilience zone, we're going to get overwhelmed chronically. We're going to feel exhausted chronically. We're going to feel as if we've lost control chronically. So the other thing that I want to mention here, an upcoming loss or death can absolutely have an impact on your identity, how you define yourself in the world, and how you explain your life story to yourself. This is Dr. Lisa Shulman. She's a neurologist at the Maryland School of Medicine. She talks a lot about anticipatory grief and how it impacts the brain. So grief, anticipatory grief and grief, it's associated with disruptions in brain function that lead to confusion, disorientation, detachment, and increased forgetfulness. So there's been an emotional trauma and emotional stress. And then much of the brain is focusing on managing that stress. So that's why we may not be as organized or attentive, present. We don't have as much cognitive flexibility like we're used to. And following an emotional stress, an emotional trauma, there's going to be triggers in our environment, like daily reminders of loss that are just going to repeatedly activate our body's fight or flight response. So this can lead to, this vicious cycle of distressing dreams, insomnia, hypervigilance. We're going to feel anxious. So a normal response to life disruption. So family members are also responding, not just our body and mind. Family members may feel like they're just, kind of going in this automatic motion of everyday life. They may try to protect their loved one by not wanting to talk about the illness or the future, and vice versa. Everyone wants to protect each other. Everyone's coming from a good place. No one wants to hurt anyone. No one wants to say anything that might trigger another. Family members may very well feel angry at the diagnosis. The healthcare workers, the thought of the person dying and leaving them alone. There are a lot of heightened emotions. The unknowns of the future, are absolutely overwhelming. Self-care can suffer. And again, everyone will experience a different range of reactions and emotions. There are many thoughts and feelings that come up that can feel intense and overwhelming. So again, just knowing that everyone is responding differently can be very helpful. But first and foremost, just identifying within yourself, what's happening. What do I need? Asking yourself that question. What do I need? Do I need water? Do I need sleep? Do I need to talk this out? What am I needing? This is just to show how stressful anticipatory grief is on the family. There's emotional distress. There's the threat to stability. There's that exclusive focus on patient care. There are a lot of personal losses and tasks related to end of life, transition. So the idea here is, can you find a way as a family, whether you find like a therapist or a mediator, facilitator, that can help just bring everyone to a level of understanding within each other, so that they can use that time to really bond and to really focus on conversations that, whatever that may look like. It could be honest conversations of, I'm feeling this way, and and this is how it's impacting me, or to say, this is how you impacted my life. And every family is different. Every family is going to want to focus on different things. So it's a family decision, which can also be very hard to make during this time. So I also want to say that anticipatory grief can occur after anyone that you love has passed away, as you anticipate birthdays and holidays, any anniversaries, any other important dates. Anticipating an emotional experience of loss, that's very intense. It requires support, and social support is healing. We need community. We heal in community. So again, just to normalize, anticipatory grief is a grief that begins with a diagnosis of a terminal illness. The feelings of loss that you and your family and friends may be experiencing is called anticipatory grief, and it occurs on several levels. It will affect your psyche in different ways: socially, physically, emotionally. Your thoughts get impacted spiritually. So the social part, the changes in roles and responsibilities for a patient, for a caregiver, this can really lower self-esteem. This can come up. You can feel self-conscious. Former activities and interests may no longer be available. This too is a loss. Some people might feel indifferent to social contact and they withdraw. Others need company, but might find it hard to ask. People may have unrealistic expectations of patients about their physical capabilities and emotional level. There is, of course, a physical toll, that loss of independence physically, and there's memory loss and fatigue and chest tightness and sleep difficulties, and appetite is disrupted. There are a wide range of physical signs as well. And then common emotions: sadness and tearfulness, anxiety, fear, irritability, anger. You may feel anger, sometimes extreme and uncontrollable anger, at the unfairness of it all. And again, that's normal. It is unfair. You may also have to cope with a dying loved one's anger. You may experience loneliness. You may experience the desire to talk. And if you don't have that safe space, that safe place to express your grief, these emotions can lead to social withdrawal or emotional numbness. So that's why I really support talking with someone you feel comfortable talking to. So there are two types for now of experienced loneliness that can be felt in anticipatory grief. So there's a fear of future loneliness. And then there's also present loneliness in your feelings. Both of these can be better addressed by talking to friends or family, attending grief support groups, even the ones that are online. You might feel like it's not normal to feel alone when your loved one is still alive, but that is furthest from the truth. Everyone, within the family system on an individual level will experience some degree of loneliness. There may also be guilt that comes up. Watching someone suffer can bring you feelings of guilt. You long for your loved one to be free of pain, but yet you still want them with you. You may feel survivor guilt. You may have this intense, extreme concern for your loved one about their emotional well-being and physical and spiritual. You may, as a caregiver, you may put your needs on the back burner. And then current grief can bring up old feelings, unresolved issues. And then of course, stress can interfere with how well the mind functions. This is actually why sleep is very important. And sleep is usually the most disrupted during this time. So figuring out, talking to your primary care doctor, talking to someone who can help you with sleep so that your mind can function. You may feel like you're going crazy. You may fluctuate between denial and acceptance. Your mind may be preoccupied with thoughts of how you or your loved one will die. Patients sometimes think they're being a burden to the family, and no matter how many people will tell them you're not, that's still a thought that might come up. So even imagining the actual event, these are thoughts that really elicit a lot of stress and anxiety. Worrying about finances. So spiritually, there can be changes too. Sometimes people, who believed in God stop believing in God. Sometimes people start believing in God. But there is an attitude and perception of changes that are occurring, and that can also affect how every individual copes. Some people hope for miracles. Some people will question their beliefs, their values, search for meaning in their life, or pursue some type of spiritual practice for inner peace. There's also a mourning for hopes and dreams and unfulfilled expectations. These are all natural and an important part of the grief process. It can be hard to talk about, but it is helpful to talk about with people you feel emotionally safe talking to, people who you will just let you say what you need to say without them saying, that's not true, or no, you're not, or, just to let you be in that experience in that moment. So again, this just highlights the family and the caregiver and how they are impacted. There's helplessness and hopelessness, the shock and the numbness, the yearning. There's an increased intense yearning for things to be the way that they were before. And then, of course, with increased stress and anxiety and fear, there's the family role that changes, and there may be more fighting going on within the family. Fatigue may sometimes be experienced as apathy. Sadness and anger, of course. It's common to feel frustrated at this situation. So anticipatory grief can also help you prepare for the loss. It can give you some time to absorb the reality of the loss over time, rather than, a sudden death. It can help you to say goodbye in your own way and complete any unfinished business. Reassign family roles, adjust to the changes gradually. So what can help is, first and foremost, taking care of your physical self. So trying to get plenty of sleep, eating well, letting family and friends help you get through this. Saying yes when you mean it, saying no when you mean it, and being patient and gentle with yourself. I would put that at the top of this list, because this is a very vulnerable time. And just being kind to yourself, not judging yourself for the process that you're going through, just letting yourself go through the motions. So again, the resilient zone. So this is just highlighting the safety that we need to get into the resilient zone. And this can be hourly. This isn't like an end goal and we stay there forever. This can be, hour by hour, breath by breath. Physical safety, emotional safety, mental safety, social safety. So asking yourself, who can I talk to about this? Okay, what can I do to help with these thoughts that just keep me locked in what I call a mental torture chamber? How can I feel safe emotionally? How can I let these feelings out in a way that help me best? Journaling or some type of creative project doesn't always have to be necessarily talking. The point is to just get the emotions out. So a practical tool, mindfulness, observing the present moment without an evaluation. Sometimes this can be very helpful when you're noticing yourself out of your resilient zone, just to bring yourself to the present moment. If sometimes like it helps to have some type of like physical movement, like bringing myself in this physical moment, in the present moment, observing 5 things in the room, focusing on your breath, naming it, saying, yeah, I feel sad, and allowing yourself to feel sad, and, not necessarily staying in it in a way that disrupts your functioning, but acknowledging the feeling. And then talking candidly to yourself. So just being honest with yourself. Family members can work together towards an acceptance of the approaching death of a loved one. The closer that the family members are and the more love that's expressed, the more at peace the family will feel. Of course, it doesn't take away grief, but there's just, an increased sense of peace. So maybe you can use this time to talk with your loved one, about what's bothering you or what's bothering them within reason, learning more about what they want, what are their end of life wishes, how are they feeling with this, how is this impacting them, hearing what is going on in their world, asking them if they are interested, can they write you a letter that you'll read in the future? I like to recommend the letter writing, to have patients write letters to every member in the family, because that can be very cathartic after they pass away. Or just chatting, just having a chat, talking about, the good memories, how they impacted you, stories that were funny, who they were before you knew them. These are all conversations that can still occur, and it doesn't have to be this dread, this feeling of dread. It can still be like this quality conversational experience. So there's other things to do to cope. Redefining hope, focusing on quality of life, forming a community of support, creating a support network, relying on medical and mental health professionals that are involved in your loved one's care, the hospice nurse or doctor or social worker. They can also provide emotional support and help you with this transition. And for me, top of the list, connecting with your loved one. Just connecting, finding time to enjoy being with them. A quote by C.S. Lewis: "No one ever told me that grief felt so like fear." So the feelings of loss that come in the days, weeks, and months leading up to someone's death, again, this is an unknown time. This is anticipatory grief, and the fear of losing anyone we love can be immense. And so I like to normalize having a conversation about it. Anticipatory grief can also provide a space for healthy goodbyes that can be spoken or unspoken. So a conversation, a letter, it can be hard to say goodbye, and everyone is different in this regard. And it's important to identify within yourself what feels best for you. Saying goodbye can bring up a lot of anxiety for a patient, for family members. Sometimes it's easier to just be in each other's company and create good memories and uplifting mood. Sometimes it's easier to just be there and not say anything or do anything. Sometimes it can be helpful to take care of the tangible tasks that come with the end of life or threat to life. A will, a letter to each family member, or video, funeral arrangements. Thinking about concept of legacy and what that person wants to instill or what they instilled in their loved ones. So post-traumatic growth is a term that you may hear also with this in this community. And I just want to highlight, it's not a goal, it's not a pressure, but we cannot help but grow and be changed regardless. So there's this phenomenon known as post-traumatic growth, where people may experience, psychological, social, or spiritual changes after an emotional trauma. Usually that growth requires insight. So it's because, you were thinking about, like, how did my values change? Like, what's important to me? What is less important to me now after this emotional stress experience? Exploring the existential questions, how your values have changed, what the values are of your loved one, how your meaning of life changed, what is your loved one's meaning of life, how you can honor your life, how you can honor their life, how mortality has been redefined for you, and how life in general has been redefined for you. So self-care, getting back to the resilient zone, taking care of yourself, drinking water, eating, sleeping, moving, calming gestures. This is a calming gesture. It can be keeping a journal, writing it out, expressing yourself. So engaging in creative activities, painting, music, singing, dancing, to help process grief, express your emotions, and foster this restoration after a loss. Surrounding yourself with supportive people. As human beings, we're wired for connection. So it's important to have at least one other person that you can speak candidly to about your loss, We need others in order to grieve well. And then lastly, just the proactive coping that gets talked about sometimes. Again, the tangible, getting your affairs in order, the intangible, what can you do today that will help you feel more at peace? What can you do in this hour, in this moment? What do you need? Who can you ask for help, support? And so, just the bigger picture, that anticipatory grief, it's a space for normalizing the human experience, the human response to losing someone that you love. This is just a final tool. It's called R.A.I.N. And it kind of helps you go through what's happening right now. Do I want to say yes? Do I want to say no? And it keeps you in the present moment, but it also helps you practice self-compassion. And that's it. Thank you all for your attention.
Thank you so much, McCall. This was just full of information. Got some messages just about how affirming and validating it was too. So thank you so much. A few questions came in, so I want to jump right in and honor
Yeah.
everyone's time. So the first question is, I think a part of me feels like if I can work with anticipatory grief and find balance, somehow this will avoid feeling the actual grief when that day comes. But what I sense is that this is not the case. Can you talk about the relationship between anticipatory grief and grief?
Yeah, so a lot of times